Hello, good morning everyone. My dear friends, today we are going to learn. It is not a topic of dentistry, but still it is very important in dentistry, that is ethics in dentistry. Myself, Dr. Shubhankar Kumar Singh from Dr. Singh Academy. So, why I choose this topic? Because ethics ethics is the moral principle that guide our behavior as professionals. Unlike law, ethics are not always written but are expected. In dentistry, ethics form the backbone of trust. If you work ethically, it gives your patient trust on you. So, ethics is the moral principles. What is the difference between ethics and law? Just now I spoke. Ethics is as a moral principles is not written anywhere, but law is written, or it is very important in dentistry. So, why ethics matters? Ethics is not just theory; it directly impacts your practice, patient trust, ethical dentist more. It gives you, it builds trust, improves outcome, reduce legal risk, enhances reputation, and it is very important in long term success. It also protects from any medico legal cases. Then, what all core principles? That is, these six core principles are there. That is autonomy, beneficence, non-maleficence, justice, veracity, and confidentiality. These six principles of dental ethics, if you remember these, you can handle most ethical situations in your practice. Now, first comes autonomy, means patient has right to decide, where our role is to guide, not to force for the treatment. Always explain all options clearly before proceeding. Informed consent mandatory, which I spoke in previous consent lecture. You can go and watch there and learn from that video. All Everything is explained there. So you should explain everything, all risks or any alternative treatments. Then second comes beneficence, means acts in patient's best interest, provide necessary treatment. This means doing good for the patient. Your decision should always benefit the patient, not your income. Then non-maleficence means do no harm, avoid over-treatment. Means any treatment which is not required, you should not force for doing sake of money. This is called non-maleficence. Then justice. Treat all patients equally. No discrimination. Every patient deserves equal care regardless of financial status or background. Veracity. Be truthful in diagnosis and treatment. Avoid false claims. So, if you're doing truthfully, honesty, this builds your long term trust on the dentist or the doctors. Then, confidentiality means it protect patient data, take consent before sharing cases, means patient information is private. So, use your responsibility to keep confidentiality. Never share patient photos or data without any consent, especially on social media, which is nowadays very frequently sharing photos. My dear friends, without consent, you should not share any photos of the patients. Otherwise, this is comes under your medical legal cases. So be careful. Next, these all are ethics which we follow. In India, Dental Council of India makes code of ethics. Now Dental Council of India changed to National Dental Commission. We have to follow all the code of ethics guidelines given by the National Dental Commission or earlier by Dental Council of India. So we should follow the code of ethics. Key rules. Important rules including no misleading advertisements, no fee splitting means commission based practice you should not do. Maintain all records, display qualifications. This all comes in key rules. So this is consent again comes where I spoke about consent. I am not going to talk about consent. It is already there in channel. You can go and watch their entire consent pro forma given. You can download and you can use it. Consent is three types, that is implied, express, written, mandatory for all surgery, all treatments. Then social media ethics. You should not fake reviews because so many company give reviews fake, people thinking you will grow with these reviews. My dear friends, Google has very good algorithm. Now is AI generated also is there. So Google will definitely find out and might they block your page, suspend your page. So please be aware. Then consent before posting photos. I spoke already. No exaggerated claims, especially in digital era. This is all very important. Then ethical dilemma means you will face difficult situations like patient refusing treatment or financial limitations. In such case, always prioritize patient welfare. So you should not over treatment pressure. If patient not willing, you should avoid. Then modern ethics, that is digital dentistry, data privacy, corporate pressure. With digital dentistry and corporate setups, ethical challenges are increasing. So, data privacy and over treatment are major concerns. Suppose case scenario 1, patient wants extraction, but when you are seeing photos, patient examination, this tooth can be same, but patient want extraction. You should explain all the things whatever treatment is required, but respect the patient decision. If patient willing to go for extraction, you should not force for any other treatment. Case scenario 2, poor prognosis cases, be honest and give all the options. In case of poor prognosis, never give false hope just to retain a patient or sake of money. So, my dear friends, ethics is only in what I can say is moral principle. Ethic versus law. Ethics, I just now spoke, is moral principles. Law is legal obligation. In other ways, ethics, you can say, doing the right things. But law is following the rules, and good dentists follow both. Then common mistakes what we do as a dentist, over treatment, where all no not required treatment, but we forcefully suggest you should do this you should do this, but patient not willing. No consent taking, poor communications. Avoid this to build a strong practice. How to practice ethics? Always be transparent, document everything, always keep the patient first. Means if you do these all things, the secret of long term success is this only. Be transparent, keep all the documents properly, and patient first approach. What patient willing? You should understand that. And you give all the necessary requirement regarding treatment. Explain everything. Then only you should proceed with the treatment. So, if you do these all things, your practice will be success in long term. Key takeaway message, always remember, patient welfare is the priority. Means patient welfare comes first before profit or convenience. So, my dear friends, this all from the ethics in dentistry. In one simple language, ethics is nothing, is our moral responsibility. What you feel, not legally, ethical way. I spoke already. Ethics nowhere written. You should follow the all the things what is required ethical way. So, with this, I end here. We'll see you next class or next lectures. If you have any questions regarding this or any other topic you want, you can just comment below. or you can mail me. I'll try my best to answer all the questions. If you required any other topics which you want to learn and know where you find, you can comment in or you can mail. I'll try my best to answer or arrange some lectures. Thank you from the Dr. Singh Academy. Thank you. Bye.